Is the water that you're drinking actually staying in your body and hydrating your tissues, or are you mostly peeing it out? Hi, I'm Dr. Patricia. I'm a holistic medical doctor. Today, we're going to be covering a super important topic, which is water. Water is, other than oxygen like air, it's one of the most crucial nutrients for life, even more so than food. As you know, you can survive longer without food than you can without water. And the question is, are you drinking the right kind of water, the kind of water that will stay in your body, get into your tissues, and hydrate them deeply so they can do the work that they need to do? Or are you drinking the kind of water that you're peeing out and it's not staying in your body and it's not hydrating? And chances are that you're drinking the kind of water that you're peeing out. And I'm going to go into why that is. So, what happens is that if you just take water and you take everything out of water, like you take minerals out of water. Minerals are things like magnesium, sodium, calcium, potassium, phosphate, iron, all of these minerals. However, when you take those minerals out, what you're left with is distilled water. And if someone were to drink water that has no minerals in it, that water is actually toxic to the body. Drinking distilled water is very toxic to the body because the body needs the water to have minerals in it in order for that water to get into the body. Otherwise, if you drink distilled water that has no minerals, that water will pass through your gut and pull minerals out of your body into it. So it'll actually pull minerals out of your body, and that's damaging to the body. And there's over 82 minerals that our body needs for optimal health. Now, if you drink that distilled water that is lacking mineral, that water is hungry for minerals and it'll pull minerals from you. So what we need to drink in order for the water to not pull minerals, but rather be pulled into our body as a result of the minerals that are in it, is you need mineralized water. And essentially, that's another word for water with electrolytes. So what are electrolytes? Electrolytes are these minerals that are dissolved in water, and they're like the spark of life. They do things like tell the cells in the body to open up so that the water can come in. So distilled water is one end of the spectrum, which is really, really harmful. The other end of the spectrum is something like seawater, where it has a lot of minerals in it, a lot of electrolytes. And if you were to drink a water that has a lot of that, that's equally not good for you. So you need to find that balance in between. And what the research is showing is that, and this is very interesting because what they did is they took a number of samples from tap water across North America, and they found out that because of the process of filtering our water, the minerals that are naturally found in nature in water can be stripped out of the water. Before about 100 years ago, when we had sanitation come on board and cleaning of the water, filtering of the water, we would drink our water from spring waters. And what happened is that as the water is passing through the rocks and the soil, it's picking up minerals, so that water is naturally mineralized. You can buy the mineral waters that come from different countries. Some countries pride themselves on having sources of really clean, highly mineralized water. And so some people will buy bottles of mineralized water, recognizing that there is a health benefit to mineralized water. Why? Because research shows that when you drink water that is low in minerals, which could be your local tap water, you're actually not hydrating yourself properly, and your mineral levels in your body go down. And not only are minerals in your body important for making sure that the water gets into your tissues, into your body, into your cells, those minerals also do other things like make sure that your bones are getting enough minerals like calcium and magnesium. Make sure that your acid balance in the tissues are not too acidic or not too alkaline. It's in the perfect Goldilocks zone. The way that your brain communicates with every single organ and limb in your body is through the nerves, and those are electrical signals that depends on the spark capacities of the minerals to conduct those messages. So if you have been drinking water that is low in minerals over time, what you're going to notice is that even though you're drinking a lot of water, you don't really feel or look hydrated. You might have dry skin, you might have dry lips, you might feel a little bit constipated or very constipated. And all of your bodily functions are going to slowly decline over time because they're not getting the hydration and the minerals that they need. So how can we fix this? What I do is I add a certain amount of minerals to my drinking water through the day so that I'm assured that I am getting a very certain amount of minerals in my water so that it becomes hydrating water instead of dehydrating water. You can make it at home very cheaply, very effectively. So the first piece of information we need to know is that the Food and Drug Administration in the US tells us that the definition of mineralized water is having between 500 milligrams to 1,500 milligrams of salt in 1 liter of water. You don't need to know this. I just want you to understand that when I tell you how much minerals to add to your water, it's a very scientific calculation. The other thing we want to know is that the recommendation for women and men drinking water is that men drink about 3.7 liters of water a day and women about 2.7 liters of water a day. What am I going to use as my source of mineral at home? Well, there's two sources of minerals. One is table salt, and one is a sea salt or a rock salt like Himalayan salt. So what are the differences between those different options? The natural salts have other minerals like calcium, magnesium, potassium, phosphorus, all these very important minerals that may not be required in as high concentrations as sodium and chlorine in our body, but are required in small trace amounts, compared to table salt, which is 50% sodium and 50% chlorine. So when you use something like Himalayan salt, Mediterranean salt, ocean salt, you're more likely to have a more complex spectrum of minerals or electrolytes than you would if you were to use table salt. If you eat a lot of table salt, you increase your risk for hypertension, death from all causes, and cardiovascular disease if you hit more than 6 grams of that a day. However, if you have less than 3 grams of minerals from salt a day, that also increases your risk of heart attacks, strokes, and death. So there's this Goldilocks zone for salts in the middle. And my point is that when you choose to use something like Himalayan salt or Mediterranean salt or oceanic salts, you're more likely to get a full spectrum of different minerals and a lower amount of sodium and chlorine compared to if you were to use table salt. And then the question is, how much of that should I use? So what I did is I used that recommendation from the Food and Drug Administration that a mineralized water should have between 500 and 1,500 milligrams of salt per liter. And I chose the middle just to be safe. So 1,000 milligrams per liter. And what you do is to get that mineralized water concentration that is recommended by the Food and Drug Administration, you add in 1/8 of a teaspoon of that salt into your 1 liter of water, and you mix it and you dissolve it. And that 1 liter of water goes towards your 2.7 liters per day or 3.7 liters per day. So you repeat that with the rest of the water that you're going to be drinking. Now you should mineralize then your water, the water you're going to be using for your coffee, the water you're going to be using for your tea. So one thing that I've done is I've learned how to make what's called a salt solé and how to use the liquid from that to mineralize my water for a very effective and very cheap solution to creating a super powered electrolyte drink. First of all, salt solé is when you take these Himalayan rocks or any sort of natural salt rocks. These ones came from my local store, Nature's Pantry in Smithers. Shout out to Nature's Pantry. Great store. I love the people there and great quality products. Very well curated. And one of these will last me for, I think it was 6 months last time. So what you do is you take this rock salt and you put it in a glass jar. It has to be glass, not plastic. You don't want the plastic to leach into the water. You put the salts into the jar and then you fill it up with water and you let that sit for 8 hours. And what that does is that it creates what's called a brine, where it saturates the water up until a certain point and then it doesn't get more salty than that. And that point is around 26 to 30% salt in water. So when I take a teaspoon of this, for example, it's not 100% salt in that teaspoon of water, it's 30% salt in that teaspoon of water. And it is definitely dissolved by that point. Whereas when you put the granules of salt and you're stirring and you're stirring, I mean, you might get bored of stirring long enough for it to completely dissolve. In the Salt Soleil, it's spelled S-O-L-E. It's 100% dissolved because it's taken 8 hours for it to dissolve in, and now it's sitting there. And the nice thing is that you basically can use this up, and then what you do at the very end, when it starts to get low, you fill it up with water, and you keep doing that. Over time, the rocks will dissolve. And once it's gone so that there's no more rocks, which will happen probably in about 6 months, by the time you use this entire bag, then you just drain it out, clean out the glass, and start a fresh one with a fresh packet. And this is so salty that nothing grows in it. So as long as you don't accidentally drop something in it, it's very clean, very sterile. And so what is the proportion of how much water to the Salt Soleil, to the salt brine? You put half a teaspoon of this for 1 liter of water. What I've done is I put that into my dropper. And I know that this dropper, when I fill it up and I release it, it gives me a quarter of a teaspoon. I've measured my dropper. Your dropper may be different, so you have to measure it. I don't know if you'll see the effect, but look how beautiful it is. It just swirls in there. It creates this immediate electrolyte-rich mineralized water. And you see, if you just give it a few moments, all of the minerals spread out through the water to find a home that's far away enough from another mineral, because it's dissolved down into its mineral electrolyte kind of component. Now it's positively or negatively charged, which is a good thing when you drink this water. This water is going to get into your body, knock on the doors of your tissues, and allow the water to go in and hydrate your tissues. And honestly, like, I've been doing this for a while now, and what I notice is that I don't have chapped lips anymore unless it's like really cold and dry outside, but regularly that doesn't happen to me anymore. I find that this, plus my skin is so well moisturized now, it's barely dry. I have no constipation anymore. Not that it's just the water, but that was a foundational piece. And listen to this, my food cravings are like almost completely gone. I mean, I still have like a tiny sweet tooth that's more of like a habit than anything else, but sometimes a food craving is a hidden cry for water, the right kind of water. Your body's dehydrated, it wants something, but it doesn't know how to say, drink more electrolyte-rich mineralized waters. And yes, there are minerals in your food. However, when your minerals are dissolved in water and they're ionic like this, the absorption of the minerals is much higher. So some of your minerals have to come from your water, and some of them have to come from your vegetables, from your fruits. Processed foods are very, very high in a few minerals and lack the complexity of minerals. They're the ones that tend to have the table salt as the salt additive. And for people who are eating processed foods, you're unknowingly getting up to 75% of your total salt allowable intake for the day when you're eating these processed foods. And the thing is, you want some of your salt intake to be from water, and you want some of it to be from food. And if you're eating processed foods, you're putting it all towards the processed foods, and it's potentially not the right kind. It's not that beautiful complexity of the trace minerals in small amounts that we do need. So if you want to really level up your health, pay attention to mineralizing your water, not too much, not too little, just like how I taught you. Cut down or cut out processed foods from your diet, and consider switching from a table salt to a natural salt, because they do have a more complex range of minerals.